assessment and certification, and also bringing overseas skill institutions in this entire ecosystem. So this particular NSDC international focus is on engaging with the foreign institution, foreign countries for demand side, and then creating a supply line so that there should be a free flow of information from here. If you look at this report, this will give you a clear idea that India is one country, as per Corn Ferry report, that by 2030, India would globally there would be a demand of about 18 million of healthcare workforce, comprises of doctors, nurses, caregivers, elderly care, terminal care. These are kind of job roles which we are getting from these foreign countries. And in allied healthcare, if you look at dentists, pharmacists, dialysis technicians, respiratory therapists, ICU specialists, and physiotherapists. And India is only one country which has a surplus workforce after meeting our own requirement. If you can see in blue, we are surplus. Rest all are either deficit or significant deficit is there, or an acute deficit. So that's where India can really play an important role by providing this supply of skilled workforce. So currently we are getting under skill mobility partnership agreement. I'm highlighting this skill mobility partnership agreement because under this agreement, our government of India signing up with government of the foreign countries, and under which we are working as an NSDC to bring an ecosystem of demand and supply. So these are 15 countries which has come forward for a skilled workforce from India. And if you look at this slide, we have the country which are with the mature migration system, where they are set migration system, like country like UK, country like Canada, country like Australia. These countries have a mature migration system and they have come forward for a healthcare workforce. Similarly, GCC countries and the European countries. So these 15 countries are looking for a manpower healthcare workforce from India, and as per WHO report, India is in now green category. We can now supply workforce to the foreign country. Earlier we were not. That is one good sign that India can really contribute to the to make India the skill capital of the world. So this, if you look at this slide, you can get a fair idea about how these requesting for a demand to India. Australia, like for example, 60,000 is a unfilled demand of healthcare workforce. 60,000 workforce is pending with us. The Germany has shared a demand for about 255,000 healthcare and allied staff. They're looking for a kind of a supply from our side. Japan, for example, 37,000 openings are there. UK, you all are aware that UK is dependent on India, and our southern state like Kerala is contributing to it. And we have got about 116,000 demand, unfulfilled demand from UK. Similarly, Romania and Sweden. Recently, we have got a requirement from Israel and Singapore also. So demand aggregation has already started from foreign country to India, and now we are working on making India ready for a supply line. So that is where I think most important aspect is now supply line also to be created from India to support these demand. Similarly, we have a demand from all other countries, as has been highlighted, for 15 countries. If you look at this slide now, when we say demand is there, but what kind of people they are looking for? What kind of requirements are there from these foreign countries? This is very pertinent to make our young workforce in healthcare eligible for the job opportunities. In the colleges or outside colleges, the most important is we should understand what kind of skills they are looking for. Language requirement, for example, English IELTS, 7 band overall for UK. And similarly, IELTS, this is for OET. There are 2 tests which are must for the candidate. One is IELTS, which is an English language test conducted by IDP, or there is a test called OET. These 2 tests a candidate must attempt, either of the 2, and should have the score which has been highlighted. This you can see common in all the countries where they are looking for, barring Germany and Japan. Germany, they have a requirement of German language, which is B2 level required. And similarly for Japan, they are looking for N4 JLPT test and above. So these are language requirements which a candidate must fulfill for all these countries. I mean, if you see other countries also, every country, all those 15 countries who are looking for workforce from us, their requirement have been listed here for language. Similarly, if you see domain skills, these are different in different countries. Like for example, for UK, you need to have CBT test and also the OSCE test, which is must before a candidate get a job for a registered nurse. OSCE is Objective Structured Clinical Examination Test, which currently happen in UK. That cannot be done here in India. So that is one challenge our candidates are now facing, that they attempt IELTS here for UK, they do CBT here, they do OSCE there. They go on a short-term visa or they get a job, appear for the test there, and then they have to clear this test. We at NSDC, we are trying to bring OSCE in India, which currently is not there, but we are doing it. Recently, a delegation from India went to UK, led by NSDC International, and our focus was G2G arrangement. We met the stakeholders there, and we talk about the demand aggregation, supply line, and also we touch upon OSCE test can be conducted here back in India. That is our focus area. Similarly, for United States, NCLEX RN is important for registered nurses, which currently happen in India. This is the good news, that apart from IELTS, NCLEX candidate can appear here and they can go to these to United States or Canada. For both the Canada and US, you require NCLEX as a domain skill test. Similarly, if you look at Germany, you need few bridging programs apart from German language. Their focus is more on German language, but some technical initiatives are also required. So this is how we understood the requirement from our foreign partners. And then we are working on making a supply line as per this criteria, which has been highlighted on this slide for all those 15 countries. So the question is now how we are doing it. We have taken it as in the project mode. We don't want that we miss this bus, because the project is, we are getting requirement and our focus is to support 100,000 Indian healthcare professional, particularly nurses, by offering them mobility, ethical migration, and life-changing career opportunity across the globe in healthcare sector. This is how we have kept our mission of training 100,000 nurses in next 3 years. This is our focus, and close to about 1 million care workers by offering them ethical migration and promising overseas employment opportunities. This is project which is initiated by NSDC International, and our focus is that by 2026 we should be able to get this supply line ready for it. Now, this is very, very important area. How we should do it, as has been highlighted, one area is demand side. The demand under skill mobility agreement, we are getting it. Now, the most important area where our partners or our stakeholders like AIMS, Nursing College, and other institution can play an important role is creating sustainable supply pool of candidates. Very, very important area, and the challenge we are facing as of now. How we can create a pool to meet the demand which is coming from these countries, and then how to build that capacity so that we can sustain this demand, by our ecosystem. So we have already started getting demand under G2G. So like it was being highlighted by the earlier speaker, that the demand is coming from the agency. That is one area only, partners. But we are getting direct demand aggregation also from these countries. Direct employer connect is also being built, and the prominent partners are coming forward, creating sustainable pool of candidates. Now, what we are doing Now we have two level of intervention required. One is for the students who are already passed out and available in the open market. Through NSDC, international centers are being set up in India, and that is for students who are already out of the colleges. Other focus area is that we prepare them while they are in the campuses to create a sustainable supply line. Now, if you look at here, if we are getting three type of demand from these foreign countries, very important area, which will give you a fair idea that immediate demand cannot be met through colleges, because colleges, students are still in the classes and they may not be ready, they may be in the final year. Immediate demand require the students or the workforce with certain amount of work X. We call it a just-in-time demand through readily available resource pools. So what we have done, we have set up NSDC international centers in different parts of India. We have close to about, through our partner network, near about 26 centers where we are getting the supply line ready for just-in demand. One of the center like AIMS New Delhi is here with us today. AIMS Punjab, we have set up NSDC International Center, wherein this immediate demand is being taken through by training the supply line of the current workforce. Similarly, midterm demand for next about 6 months time, that is also being done through those NSDC and partner centers. The third very important point is long-term demand. This is through the colleges, where we have to penetrate and get in the colleges right from day one. We should train them so that down the line, after 5 years or 3 years, 4 years, the students who are moving out of the college, they should be readily available, by giving them English language training intervention and by training them on a domain skills. This is how immediate demand, midterm demand, and long-term demand is being taken care. And I want to highlight here very important aspect, that now most of our states in India are becoming a feeder state for different countries. For example, Kerala, which was earlier known to be a hub for GCC country, is now emerging as a feeder state for UK and Europe. And for GCC country, Jammu Kashmir is coming forward, UP is coming forward. Similarly, Gujarat for United States of America, Canada for Punjab. Punjab is acting as a feeder state for Canada, Maharashtra for Germany, Northeast for Japan. This is how most of our states can cater to different countries. This is a very new concept we have got it, that feeder state approach. Let us focus on the states where student has aspiration for a particular country. Like Punjab, the fascination is already there for Canada. So Gujarat is for US, Kerala for UK. So this is how we are working on these states to cater to particular countries. So our focus to get the supply line, as I said, demand is there. Supply line, what we have done is we have recently tied up with Indian Nursing Council is our partner. And with Indian Nursing Council, we are creating a pool of 80,000 students, supply pool through Indian Nursing Council. They have a live register called NRTS. They have a live register on their portal, and they have a record of about 1 million nurses, working nurses, out of which we are focusing on training about 80,000 nurses for immediate supply line in next about 3 to 4 years. And 20,000 is through prominent partners, and 20,000 is through our 25 NSDCI on center, which we have set up in India. Similarly, if you look at, to do this, we can't do it alone. NSDC is a umbrella, is a government organization leading different ecosystems. So we have Indian Nursing Council as one partner. We have Healthcare Sector Skill Council of India as our partners. Healthcare associations in Pan India, largest hospital association AHPI is also associated with us. We've also brought largest training agencies. Similarly, the CBLA, like OET is our partner, which conduct OET test. IDP is with us, Goethe for Germany, and Japan Foundation for Japan. So all these partners are with us, wherein we are working on creating this pipeline. So this was for the our main healthcare. Similarly, we have allied healthcare, which is another major requirement coming forward. So 1 million, as I said, 1 million available pool of resources is there at a live portal of Indian Nursing Council. Equivalent number is available in the colleges, as I said, to meet the long-term demand. And similarly, we have 1.3 million allied healthcare professionals also there with us. The total number of allied healthcare professionals who can be trained, and the categories we have mentioned there, what kind of the allied healthcare professionals are there who can be utilized for supply to the foreign countries. This is the current live demand with us. If you see Canada, about 2,000 candidates requirement is with us. Finland, we have got 1,500. Germany, 1,700. Japan, about 1,100. UK, we have about 7,000. UAE, 1,130. And total put together, these countries, 15,030 is there. And on the right side, if you look at, these are the candidates who have come forward, who are the working nurses, who are keen to build their career in the foreign countries. We have got a data out of which 19,000 are about PSC nurses, and GNM about 13,000, and post basic are 1,500, near about 1,600 are available pool. So we are to skill them as per the foreign countries to meet the demand which is there on the screen, about 15,000 live demand available with us. So this is a value proposition we have brought as part of it, bringing all stakeholders together, digital platform, requirement, preparing student on language and the domain skill. And currently, wherever we are running this training, we are not charging any fee from the candidate. Our focus as of now is for skilling them and making India as a supply capital of the world and skill capital of the world by supplying the skilled workforce. This is how we are working on it, and in due course of time we'll bring some other models also, so that we can engage colleges and the institutions also here by providing the training while they are in the colleges. So currently all the nurses who are currently being trained in our NSDC centers or in the partner centers, they are not being charged, and the entire funding is through the NSDCI. So thank you very much about this. This was a brief which I have tried to bring together all the facts before you, and the focus here is that together on through this conference, like which we have conducted, which is being conducted today, I'm very sure we will be able to, discuss some modalities. We can collaborate with the different partners in the foreign countries. I can see the speakers joining us from United States and other countries, and we can work together and make a system wherein we can, supply the skilled workforce to the foreign country wherever it is required. And as I said, the model is absolutely ready. We have already started, and I'm sure that we will be able to make it more robust in due course of time, and will be able to realize the vision of our country, making India as a skill capital of the world. So that's all from my side. And thank you very much for giving me this opportunity to be with all the esteemed panelists here. And I'm sure that this discussion, which is being held today, will set the pace for having a very robust ecosystem. And I must highlight here that even the United Nations is working on a model where the country is facing severe shortages, not only in healthcare but also in the other areas. The countries having surplus manpower can support those countries, and with this kind of model, India is going to set the benchmark for the rest of the world. And I'm sure we will be able to do it together through this kind of intervention which are here today. So with these words, once again, thank you very much for giving me this opportunity, and over to any question. If there is any question, I'll happy to answer. Thank you very much.
Thank you, Dr. Kaur. A really impressive presentation, and really appreciate you sharing your insights and knowledge of what you're doing. It's absolutely impressive, I think, in terms of the way that you're integrating this across all of the institutions in India to meet that global demand. It's certainly world-beating, I think. Joseph, are there any questions that have been posted?
Yes, Melvin, we have few questions. Hello, Dr. Kaura, can I ask you a couple of questions?
Yes.
We have great appreciation coming in the chat box and directly to me. One of the question is, thanks, Dr. Kaura, for your wonderful presentation. Can you specifically tell how many nurses have been helped by NSDC to gain special skills and adaptability to settle abroad?
Yeah, recently, I mean, as I said, this NSDC International, we have set up this organization, and it is in 2022, and since then the interventions are taking place. Recently, when I give you a recent example of 67 nurses, we have given them the offer letters. They all have been placed in Cambridge hospitals in UK, and it's a Cambridge trust. 67 nurses who were trained, and they were given the offer letter by being in India only, and now they are flying to join that organization. But recently, if I see the put together all data till now, we are near about close to about 2,000 healthcare professionals we have given the intervention till now. But now, as I said, our target is to expand it, and this is why near about 100,000 nurses to be trained in a mission mode, because you can't do it in isolation. That is why we have brought, our focus was to bring all stakeholders together. So be it our language agencies, be it Indian Nursing Council, be it Association of Hospitals, we have brought everybody together. And now we have set the ball rolling. We feel that by 2026, we'll be able to hit this target of about 100,000 nurses and close to about 1 million healthcare workforce. Like as I said, we were in UK and we got a demand for about 1.5 lakh care workers by Care England. So now we are in the process of signing an MOU so that we can start getting those demands. So there is about 1.5 lakh care workers they require only by one of this leading the care worker organization, so care association. And this is how similarly other countries are coming forward. So our focus is on now to expand this horizon. So till now I have given you the number. Recent was 67 last month itself at the Cambridge NHS we have sent.
Yeah. Thank you, Dr. Santi. The next question is, compared to UK, Australia, very few nurses are able to go to US for working as nurses, primarily due to visa issues. How NSDC is addressing to solve this?
Very important question. I must say that the US is one of the area where US is facing a severe shortages. I must tell you, we were engaging and holding discussion with Henry Ford hospitals in the United States, and Henry Ford team visited here and we had our discussions. They said that many of the hospitals are shutting down because they don't have nurses, they don't have healthcare staff. Such kind of shortages are there. But at the same time, the visa issues are there. One thing we must understand for Canada and US, very important point, jobs are in Canada and US, both I'm talking about. In Canada, jobs are with the province, visa is with the federal. Same is there in the case of US. So the states are facing shortages in US. The province in Canada are facing shortages. However, the visa rules are by the federal agency. So what we did as NSDCI, we first, because we are getting demand from Canada, but the issue was of the visa to the candidates. We started working very closely with IRCC, which is a Canadian federal agency, and we brought them there into the ecosystem. That let us work together and you support us with the visa first. Then we'll go to the province, for a demand aggregation. So they have come forward. We are working very closely, and on their request, which my second slide was there, digitally verified credential. They were facing a problem of a verification of credentials of the candidate. We said we will do it. NSDC would do it. You come forward with us. So now the visa part in Canada is being taken care by the federal agency, and hopefully we'll be signing a MOU with them very soon. Correct, MOU, so that all visa process should happen through NSDCI. And at the same time, province are sharing the jobs with us. Same is with US. The US also, we have started engaging with the federal agency for a visa side, and the states, we are working closely to get the demand side. Very soon, the US market would be opened up, right? Which will be normal, wherein like when a market open, everybody can work there. But till the time, we are initiating our first intervention with Henry Ford. So Henry Ford, NSDCI joining hand, we are working very closely with them. Very soon we are signing MOU. Once we sign MOU, Henry Ford would be training nurses in India at about 30 locations, both for the domain skills and NCLEX, right? And the language skills for IELTS would be taken care by us through our IELTS and OET partners. So that is how we are opening the US market. Our focus is now on the US. So with Henry Ford, we want to do the first intervention, and soon we will involve other hospitals also, so that we can set the ball rolling till the time US open up their visa side. But we would be starting the intervention probably beginning of the current year, next year, 2024. Hopefully, we'll be able to start the training for the US side. Hope I've answered your question, Yusuf.
Yes, very much. That's very proactive initiative by NSDC. I think that will answer the question. We have one more question, which I'll take. I have several questions, but I'm taking you the final question because of the shortage of time.
No problem. My point is, because answering question, you can share a lot of information. Sometimes you miss, and the question set the pace for certain discussions. So this is really wonderful that you guys are asking this question, and you can please ask the question.
Yes. Is it possible, I think this is from an educator, is it possible for NSDC to work with colleges and universities to provide insight on skill gaps required to be trained to the students?
Absolutely. As I said, we have been, now we are initiating. And as I said, India is a big country and a large country if you look at, and we need to have intervention across all the states. So what we are doing now is we are starting a campaign now across India, wherein we would be going to the colleges, our teams, because you would have seen our third slide that we are present across all the districts of India. And we would be reaching out to all the institutions, telling them that these are the opportunities through our SID portal. We have a Skill India digital portal also, and other portals are there. We'll also circulate this information on social media. But however, we are reaching out to the colleges also directly, so that we can build our third circle. If you have seen intervention, the long-term demand, that is possible only through the colleges and institutions. How we are doing it? We are starting one campaign of going out to colleges and hiring, means shortlisting the students directly from the colleges who are in final year, and picking them and starting training in the colleges itself. We'll start with the final year, first time, and then gradually we'll move to the first year onward also. But first intervention is through final year students, telling them, inviting them, and guiding them about it, and then holding a selection process also, shortlisting process in the colleges itself, pan India. That we will be soon. We will be coming up with our plan, and we'll be going on social media also to create the awareness about this kind of initiative. Yes, your question is that are we doing? We are doing it, and that's our focus area for meeting our long-term demand.
Yeah, fantastic. Thank you for that answer. I think I'm asking one question on behalf of several organizations and universities who are here. How organizations and universities in foreign countries can support NSDC's this magnanimous mission?
This is really fantastic. I must say that these institutions can really support us, because we, as I said, how we are to build this ecosystem is by understanding the ecosystem in the foreign countries. You would have seen that 15 countries, we know their domain skills, the kind of language skills we require. If we get to build a competency, the third focus area was building capacity. That is only possible when the universities come forward from foreign countries. If they are here and they come forward, join hand with us, and we together train people for their respective countries, that nothing like it. That will help us to have a capacity here. As I said, US, for example. Now, if today NSDC say that we will train people here for US, we won't be able to do it, because we don't understand the US market. However, US agencies come forward, joining hand with us, skilling people here, helping us in building capacity in the meanwhile. Then we will take on. This is how Henry Ford is coming forward. So Henry Ford will come, set up the center. First pilots would be run by Henry Ford trainers, and we will build the capacity in the meanwhile. So your specific question, how these institutions can support us, joining hand with us. For example, universities from UK can join hand with us, understand and build our capacity, train our trainers, give us the content, so that we can train people in the colleges itself. So that is how Henry Ford has also given a proposal that we'll start training in the third year of the BSc nursing, so that by the time they graduate, they'll be able to get the kind of interventions there. So these institutions can play a very, very important role by joining hand, and we invite all of them to join, come forward, let's hold discussion, and we can join hand and we can take it forward. We welcome you all. You visit India, and we'll meet you, we'll showcase our centers to you, and in the meanwhile, let us initiate our discussions online, virtual mode, and let us start building this ecosystem. Your support is very, very valuable for us to build capacity. The third point, if you would have seen, demand, supply, but third area was building capacity. That we can't do it alone. We need support of the foreign colleges and universities, and we welcome you all to be with us.
Okay, thank you for answering that, Dr. Sandeep. We will close the question and answer session. Over to you, Melvin.
Thank you, Joseph. And thank you once again, Dr. Kaura, for such an inspiring discussion, and certainly shows the world-beating program that you're putting together, and I'm sure that's of great interest to many. Thank you for that. Moving on to our next speaker.
Thank you very much, and I look forward to meet the partners here. And as I said, I would like to, we invite you all, be our institution in India, be our institution abroad, come forward, let's join hand. We are available, we'll discuss the model, and as our target is very big, 1 million workers, 100,000 nurses, next 3 years, your support is paramount, and we invite you once again to join hand with us and look forward to see you all. Thank you very much. Thank you very much for giving me an opportunity.
Thank you, Dr. Kaura. Appreciate it. Thank you. And we'll move on to our next speaker, who is Professor Christine Brown-Wilson, and she's Director of Internationalisation at Queen's University Belfast, School of Nursing and Midwifery. Professor Christine Brown-Wilson is a registered nurse by original and in an international research profile within academia around ageing and dementia, focusing on service development and quality improvements in residential and community context. Christine's methodologies focus lies in participatory qualitative methodology, including co-production involving multiple stakeholders, older people, people with dementia, families, staff and healthcare students, to improve education and practice. She established links with international service user organizations and works across the UK and internationally, enabling older people, people living with dementia, family caregivers and staff to be actively engaged across the research process. Christine has supported organisations and teams in changing practice through quality improvement and developing relationship-centred services in dementia care, both in the UK, Australia, Singapore and other locations. Christine is the Principal Fellow of the Higher Education Academy and provides leadership to the School and University in Educational Scholarship. Christine, welcome, and we look forward to your presentation.
Thanks so much, Melvin, and thank you everyone for inviting me today for this absolutely, I think, inspiring conference. So, and can I just say thank you so much to both Prof. Lather and to Dr. Kaur for really outlining some of the exciting work that's going on within India. So my presentation today is actually going to address one of the questions in the chat that actually asked, once you actually go overseas, what are the opportunities for you? So I'm going to talk a little bit about some of our undergraduate work as well as some of our postgraduate work. And another part of my background is actually in curriculum development, and I've done some extensive curriculum development in nursing, midwifery and social work, both in Australia and in the UK. So I'm going to be talking a lot about our processes for that, and also, what are, where that might go in both scholarship and in education. So I am going to share my screen now. It's optimistically. Brilliant. Can you, yep, is that working? Ah, great. I love it when technology works. So, and so huge welcome from Northern Ireland and Queen's University Belfast. We are a Russell Group university. That means we are a research intensive university. We offer undergraduate and postgraduate taught and postgraduate research opportunities for both international and home students. And I just want to sort of, and leading on from Dr. Kaur's presentation, we have got one of the highest skill shortages for nurses in the UK. So we have got the highest recruitment requirements across the UK. So you would all be very, very welcome to come across to Northern Ireland and also be part of the Queen's University Belfast family. So I'm a professor in nursing education from the School of Nursing and Midwifery. This is our building. And so we have approximately 3,500 undergraduate students across our 3 years. We were established in 1991, and we offer a range of programs at both undergraduate and postgraduate level. So we have over 200 postgraduate students, 90 PhD students. So there are opportunities within the School of Nursing and Midwifery once you actually become a resident within Northern Ireland as an internationally qualified nurse. You actually do get opportunities for commissioned programs, and that means that your trust will actually pay for you once you meet the domicile requirements. But equally, you don't have to wait until then. You are very welcome to come over as an international student, and I'll talk a little bit about some of the opportunities that we offer at postgraduate level. So our mission is to prepare nurses, midwives and healthcare professionals for leadership roles in clinical care, teaching, management and research. So wherever you are in your nursing journey, we have something for you. Our overall aim is that we're committed to excellence in our teaching, research, scholarship and clinical practice, and we contribute to both local and global efforts to improve the health and well-being of society. So we are very keen to be working with NSDC as well as with colleges across India. And we seek to prepare our students for roles that enhance the health and well-being of society and to demonstrate leadership in the advancement of the disciplines of nursing and midwifery. So I just want to talk a little bit about educational and professional pathways and how we might be able to create global partnerships in nursing. So if we think about nurse education from a global perspective, we do know from research that degree-prepared nurses are significantly correlated with better health outcomes. And, Professor Lather has already outlined how we can support diploma nurses to move up to degree preparation. But we do know there are significant variations in standards of nurse education, both within and between countries, and even in the UK, there are absolute variations between requirements across the different universities that you might be coming into. But nurses are a mobile workforce. 1 in 8 do not practice in the country in which they were educated. I myself, you might tell from my accent, I'm not from Northern Ireland. I trained in Australia. I then came over and I did my my academic education in the UK, and I've settled over here now. So we do have a need for standardized education across countries, but it does need to be contextual to population and to the needs of that country. But we have a number of challenges that I think we need to be very conscious of. We have a global rise in non-communicable diseases. My scholarship and research is actually in one of those non-communicable diseases, which is dementia. And we also have this aging population. Now, the aging population are just not with our patients, but they also include ourselves. Our nursing population is aging. We have what we call a greying nurse academic population. So we are struggling really to bring in young nurses into academia in order to train the next generation of nurses as well. We obviously have the global pandemic where nurses are always going to be the frontline workers. We also have a rise in natural disasters in terms of climate change, where nurses are often the first responders. So we've already heard from Dr. Kaur about the global nursing shortage, and we do need to think about how we are going to meet some of these challenges collectively. So I just thought I'd just highlight the World Health Organization Global Action Plan for Healthy Lives and Wellbeing, because we do need to move towards universal health coverage. So while it's really helpful for us to be looking at India as a reservoir for nurses to come out into the rest of the world, and we very much welcome Indian trained nurses, we do also need to look at how we can support the health of populations collectively across the different countries in which nurses are operating. So these are the 3 billion targets for from 2023. So we do need just to keep those in mind. And one of the ways that we as nurses can actually support those 3 billion targets is through the Sustainable Development Goals. But there's been some interesting research done around nurses and nurse education, and we know that nurses and nurse education are pivotal to the Sustainable Development Goals, but equally nurses do struggle to understand their role. So at Queen's University Belfast, we co-designed an audio podcast with our student nurses. And what we found is once they listened to that, we did a pre-post test to look at their understanding, their self-efficacy before and after they listened to that podcast. And we saw a statistically significant increase in their understanding of the relevance of SDGs to both their personal and their professional lives. So this is one area of education and innovation in education that we are looking at Queen's University Belfast, and we just within the School of Nursing and Midwifery. And I'm going to talk about a few of how we have developed our curriculum. They're using some of these innovative technologies. So we also need to think about our nurse educator competencies, and I noticed that there was a question in the chat that Dr. Kerr very ably answered about how we can ensure we have got effective educators to promote the best competency for all of our nurses globally. So these are the global nurse educator competencies. One of the requirements is that nurse academics who are working with students should be registered in their country of work, but also they should have a minimum of 2 years clinical experience. So these are the 3 pillars of nurse education, and we are working towards the global standard for professional nursing. So we're looking at it from the perspective of learning outcomes for graduates. So again, very much around the knowledge and practice skills that we've heard how India is really moving forward with. It's around communication and collaboration, critical thinking, clinical reasoning, and our clinical judgment, as well as professionalism and leadership. And these are probably the areas that we would be looking at in our 3rd year undergraduate curriculum, but also in some of our master's programs as well. So again, there are now international guidelines for educational programs and also for educational institutions as to how we actually ensure an effective curriculum. We have high standards in that curriculum, but equally how we actually evaluate those outcomes. And some of the work that I'm going to talk to you about today is really our work in the School of Nursing and Midwifery at Queen's in relation to how we are evaluating the effectiveness of our curriculum as well. And there's real opportunities, I think, for us to join with institutions in India to to share some of these innovations with each other. So a little bit about nurse education opportunities at Queen's University Belfast in the School of Nursing and Midwifery. The MSc Advanced Professional and Clinical Practice is a popular program for internationally qualified nurses who aren't necessarily resident within Northern Ireland or within the UK. It's a 16-month postgraduate taught blended on-site program. It has 10 specialist pathways that you can choose from, such as maternal and child health, older people, cancer and palliative care, just to name a few. We offer 225 hours of clinical experience in a setting relevant to your studies, and there's also English support via our partner at Into. So this is if you're already a registered nurse, in India, this is actually quite a nice way. If you just want to dip your toe into the water to see what would it be like living and practicing here in Northern Ireland. There are also future opportunities for nurse education with us. We offer a graduate entry master's in professional nursing. Now, we're not the only UK institution to offer that, and many of the other UK institutions already offer that for international nurses. So you can come over. It's an alternative pathway to coming over and doing your OSCE and your professional practice that way. It does lead to a master's, and you are able to register with the Nursing and Midwifery Council. It is on site. There is a requirement for attendance. For Queen's University Belfast, it's not yet open for individual international students for 2024-25, but we are looking to partner with government organisations or other sponsors within country in order to look at how we might bring a cohort across to work for our graduate, to actually work with some of our practice partners for international students on our graduate entry masters in professional nursing. The degree, and this is something that you do need to be very conscious of, that your degree must be acceptable to Queen's at either a 2-1 or 2-2 level. And if it's not, we are in the process of developing BSc modules, which are 100% online for students who do need those additional credits. And again, this would be something that Dr. Kaur was talking about, how international organizations can actually work with organizations within India to ensure the parity of those degree qualifications, so that when you come across to the UK as an internationally qualified nurse, you're resident within Northern Ireland, as an example, you would then be able to come on to other master's opportunities as well. So I just wanted to talk a little bit in relation to how we might develop our curriculum. And what has gone into our Queen's University Belfast nursing and midwifery curricula is this ethos of co-production, where we actually enable all our stakeholders to be involved in the decision-making process. We have students, we have people with a lived experience of different conditions, and they're all engaged at different decision points. We provide them with accessible information and enable all stakeholders the time to be engaged in the process of curriculum development, and then ensure we have effective communication strategies. So our curriculum in terms of nurse education was entirely co-produced. We also engage our service users. This is just an example of a co-design workshop with our student nurses and people with dementia who are engaged in a co-design process for some of the learning activities that we embed within our curriculum. And I'm going to talk a little bit about some of those examples now. But it's so co-design is an iterative process. It involves all the stakeholders. So here we've got students, got people with lived experience of dementia. It's a focused and it's a time-bounded activity, and it leads to a specific output. So it's slightly different to co-production, which is what I would term an umbrella term, and it requires shared leadership. It enables the shared decision-making, and it also requires consensus building because not everybody agrees all of the time. And that is okay. But by the end of the design process, everybody can see their input into whatever we have been co-producing or co-designing. So here is just an example of how we've used co-design across our undergraduate program. We've used the dementia, so in terms of co-designing our lessons, we've used our dementia game, which I'll talk a little bit more detail about in a minute. In Year 1, we then do Dementia Friends training in Year 2, and then we have an online resource that supports intimacy in people living with dementia for Year 3. So we have that development from seeing people with dementia as capable, so the very early information that our undergraduate students need, right through to the more complex needs within a particular population. In this case, it's with people living with dementia. We also have co-designed our module. You've heard from Melvin that Prof. Lather was involved in our evidence-based practice game and implementing that across India. So that was our very first module that we co-designed. We have a Twitter feed run by students. We have evidence-based based practice champions who are also our students on those modules. And those students often then come and engage with us in some of our research and in some of our scholarship. So they are getting added value from their program. And then we've looked at how we can put co-design across a program. We've used First Frontiers and AI chatbots in our first year to welcome our students in. We then engage them with the academic integrity game, and also we provide an online wellbeing shelf. So they're just a few examples of how we've used co-design across our program. I want to talk a little bit more in detail about our academic integrity game co-design. You can see here, this takes you through the specific steps that we use in co-design. And although we've used this for an academic integrity game, which actually supports students with their study skills, gets them to understand what being a professional nurse is, and also gets them to make the link between the decisions that they make in terms of their study skills, doing well on their program, others very similar to the decisions that they make in practice to actually be ethical nurses. So this is an example of our academic integrity game. We have a number of different stories that our students go through. You can see there are 4 areas, and professionalism is a very key part of this. So this is how we actually encourage our students to understand the importance of being professional nurses right from the very beginning of their program. We give them specific scenarios that they can work through, and they also have quizzes as they go through the game. And this shows how we then engage our students with understanding that their study skills are very much related to their effectiveness in practice as well. And if they don't understand how to engage with evidence-based practice, they may well make mistakes in practice which could have detrimental effects on their patients. So we did some pre-post tests. So all of our games we evaluate. We had 233 of our first-year nursing students engage, do the motivated strategies for learning questionnaire before and after they played the game. And there was an improvement in their individual self-efficacy towards learning, but it was not statistically significant. However, there was a significant increase in their critical thinking and self-regulation, and also players were significantly more likely to seek help and peer support. We also ran some focus groups to actually find out what they liked about the game. They found it was very usable, and they very much saw the connection between, with their professional values and the importance of honesty in particular, not only in professional practice, in their clinical practice, but also in their academic practice as well. And they could see the transferable skills that they could use now across the rest of their program, which is really important. Now, this is our Dementia Games team, and we've been working very closely with Focus Games and Dementia NI, who you can see in the middle of those photos, who are actually the people with the lived experience of dementia. We also have a PhD student, Steph Craig, and our statistician, Patrick Stark, in that photo. So just this, again, this shows you a little bit more about how we can operate a co-design process to develop a game for for our curriculum. So the first thing is we asked, what do people need to know about the condition and why is that important? We then meet them again. What are the priorities for the game? What might the game look like? And then we do a final workshop where we agree the questions, we define the figures, and we identify the gameplay. So this is what our dementia game looks like. We use this in our first year undergraduate program, and we found what we do now with this dementia game, wherever we implement it, we do a pre-test, post-test study with the approaches to the dementia questionnaire, which is a 19-item scale, and it assesses attitudes to people towards people living with dementia, with higher scores indicating a more positive attitude. So our initial results here showed a significant increase across two of the subscale scores, what was most important is that players are more likely to recognise people with dementia as unique individuals with the same values as any other person. And there was a much more optimistic view of the abilities of people living with dementia and what might be achieved by them, and their attitudes all improved. So this led us on to developing a kids' dementia game. And this is a scenario-based game, but we co-designed this with primary school children and also with people living with dementia. So again, this is an example of an intergenerational co-design process, but we've used this very much to inform what children can do to help, and also what children think a game should look like. And dementia, the people living with dementia were involved at every part of this process as well. So these were our primary school children, and we had a Hogwarts, a Harry Potter style event, which they thoroughly enjoyed. And then we assessed the feasibility of this using a kids 14 scale item. And we learned a lot from doing that. What we're now doing is we're using this kids dementia game with our nursing students who are on our pediatric course or our children's and young people's program. And we have just completed the data collection for that to find that our nursing students actually have a increased an improved attitude towards people living with dementia after they've played this kids' dementia game. So although it was designed for children, it's actually also effective as part of our undergraduate nursing curriculum. So what we've moved on to do then is, I actually had a PhD student who was from Indonesia. He was talking about the importance of dementia in Indonesia and that people didn't really understand it. So that led us to get some funding, and we went across to Indonesia, and we did a co-design process there as well, where we looked at it from a much more cultural perspective. So what do we need to know about dementia in Indonesia? And what were the priorities for raising that public awareness about dementia in Indonesia? Our second workshop looked at the myths about dementia and deciding the context game for Indonesia. And then our final co-design workshop was who will play the game and what will the dementia game in Indonesia look like. And these were something, we actually asked people to write, to draw what they thought dementia looked like, both before and after that co-design workshop. And we found that people had a much more positive outlook of living with dementia following that workshop. So this is our Indonesian dementia game. And we are currently evaluating that across Indonesia. But we're also working with our colleagues in Indonesia to implement the dementia game within the undergraduate curriculum within Indonesia. So we're conducting a national evaluation of that co-designed Indonesian dementia game led by our nurse educators in University Gadjah Mada in Yogyakarta. And we're also evaluating the English dementia game with Indonesian health profession students in the same university. We're co-designing a Chinese dementia game in Singapore with undergraduate students from Singapore. And we are also translating the dementia game into Malay, Korea, and Vietnamese for use with nursing students in those countries. So there would be a welcome opportunity to also look at how we might use the dementia game in undergraduate opportunities here in India. So here are some of the publications that are associated with some of our work. And so thank you all very much. And thank you so much for inviting me along today. I'd be happy to take any questions.
Lovely. Thank you, Christine. Joseph, were there any questions in the chat for Christine?
Yes. We have a few questions. Hi, Christine. How are you?
Thanks.
So here's the first question, Christine. Are there opportunities for Indian nursing teachers to work in universities in Ireland? If so, what may be the basic eligibilities criteria? That's a question from Shashikala. Yeah.
Okay, thank you so much. There are opportunities to work as a nurse academic in Northern Ireland. I can't speak for Ireland, which we're on the island of Ireland, but we are part of the United Kingdom. So our minimum requirements would be a master's to come in as a lecturer, but we also have opportunities to come in with people who have a BSc and clinical experience as teaching assistants, and then you can work your way up into becoming a lecturer. But what we would normally ask for would be a master's. Sorry, Joseph, was that the end of the question? I think there were two parts to that question.
Oh, yeah. That's fine. Christine, second question quickly. How Queen's Belfast is training undergraduate students to develop job-specific professional skills required for them to excel in the jobs?
No, sort of say that again.
How Queen's Belfast University is training undergraduate students for job-specific skills.
Oh. Yes. No, thank you for that question. Sorry. So we work a lot with simulation and interprofessional simulation. So we have a state-of-the-art simulation center within the NBC building, which I showed you on my slide. And we run our clinical simulation skills from the beginning of the program. So the students will come in and they spend 4 weeks with us doing their skills, doing their theory, and then they go out into practice. And they go out to practice with a practice supervisor and also a practice assessor for 6 weeks, where they actually work with patients under supervision. Then they will come back in and they will do another 4 to 6 weeks of theory and clinical skills support, and then they'll go out again. So they have about, I think, 2,000 hours of clinical practice, which starts really from the very, very beginning of their program. So it's very much, all of our programs are very much skills-based, where we actually actually looking at the theory and the skills together. We integrate those while they're with us in university, and then they go and apply those when they go out into practice with their practice assessor or practice supervisor, who are employed clinicians in their particular hospital or in the community, or in they also go out into care homes, so nursing homes.
Thank you, Christine, for that answers. We have no more questions now. Over to you, Melvin.
Thank you, Joseph. Once again, thank you, Christine. I'm going to take just a few minutes just to present a little bit as a bridging mode from what's been said so far into the next session. So let me just take a few minutes just to share one or two things with you. So one of the or a number of questions and comments that were coming through today were about competency development, skill development, and of course looking at content. And I want to just position what we do here within Focus Games, and how we've been working with a number of universities and across the UK and internationally to help develop the nursing skills and competency frameworks. So we use game-based learning or micro-learning as a way of engaging nursing students and healthcare professionals. As been said already, is that nursing is a global profession. Medicine is a global profession. Diabetes in one country is diabetes in other countries, and therefore we have quite an advantage in that we can develop resources which actually can span multiple geographies, and competencies are very similar across those, and developing those competencies can be done through a number of different things. We work with game-based learning, we work with e-learning, gamified e-learning, and a number of other techniques in order to present knowledge and information to students and to professionals, and to help them develop the skills they need for their career. We partner with Queen's Belfast as one of our key partners, but we partner with a number of other health organisations here in the UK and across the world, and in particular in India as well, to really make sure that the content that we build into these knowledge experiences are absolutely critically up to date. They are relevant, and of course they address the global skill and competencies that are needed for nursing professionals to work across the globe. Everything that's in the content is obviously evidence-based and content-rich, and that's really important that we build that into any of the knowledge learning that we are delivering. And probably one of the questions might be is, well, why games? Why game-based learning? Well, of course, that's one of the key things in terms of the way in which people learn now, the different ways in which they're developed the skills and their understanding. There's a lot of research which has been published which shows specifically how game-based learning or gamification can support the learning needs of nurses. And that's a very important part, because they have to learn a lot, they have to build a lot of skills, and it's really how do we help them do that in an efficient way. And particularly when we're looking at international nursing, then how do we make sure that they build those skills that take them beyond their current borders. Some of the skills that can come through game-based and micro-learning and self-directed learning, which is really an important piece of developing your own competencies and skills, is things like clinical reasoning, critical thinking, procedural skills, quality improvement skills. And there's a lot of evidence that shows that actually using this type of intervention can really boost those competencies, and really that game-based learning, micro-learning should be really part of any nurse education at undergraduate and continuing professional development level. And it's really about getting people to work differently, to think differently. And of course, part of what you'll learn is some of those things we've been talking about earlier on, which is those cultural differences, those nuances that you develop, and also, of course, the communication skills that you need in order to be an effective healthcare professional. And that's really what we're trying to do through these micro-learning opportunities, is looking at critical thinking skills, enhancing your clinical skills, but also building that teamwork, that leadership, that collaborative skills that you need to be successful in any healthcare environment. And of course, you're doing all this within a safe learning environment, which is critical, whether that be at university or postgraduate when you're in the workplace. And of course, it's building those skills, which is really important, building that international perspective and international understanding as to how healthcare is delivered in different parts of the world. Of course, there's nothing wrong with making learning fun and engaging and interesting, and that's what we try to do through these learning environments, whether that's simulations, whether it's online, whether it's face-to-face. It's about giving that experience and allowing people to shine and to build their competencies. It's definitely a new way of learning. It's definitely a new way in which people are taking on those skills and competencies. In India, we've been working very closely with a number of academic institutions to develop resources to meet those demands, particularly around that BSc nursing curriculum, and of course expanding beyond that into other programs. I'm not going to take too much time onto the rest of that, but really just wanted to highlight how using different techniques and different technologies can really develop the skills and competencies that can take a nurse from their initial undergraduate studies right the way through to developing them for that global career that they're looking for. So take a look at some of the things that we're doing and have a look at what we're thinking around. And if you want to get in contact, then please do so. So that was really just a sort of a link from where we were in the previous conversations to looking forward now into the second half. So without further ado, I want to invite our next speaker, who has very kindly got up very early from in the US, and that's Jose Arnold Tariga. Dr. Jose is an internationally educated nurse with more than 15 years professional experience in various clinical educational settings in the Philippines, the United Arab Emirates, and the United States. His area of expertise includes critical care in both acute and long-term settings, healthcare quality, and education in clinical and academic settings. He's also very passionate about professional development and mentorship. He holds a PhD in development education from Central Luzon State University, 2 Masters in Nursing from Cebu Normal University, and a Bachelor of Science in Nursing from Holy Name University, and a postgraduate certificate in training to teach in medicine from Harvard Business School. He's a certified professional in healthcare quality and certified nurse educator and board certified in nursing professional development. He is currently the Director of Clinical Education Development in Insight Health, where he's responsible for leading and developing the implementation of international transit to practice program of international educated nurses migrating to the United States. He also serves on the board of Directors of Society of International Education Nurses in North America and an ambassador for United Vessel of Love Foundation, advocating for underserved communities in South Africa. So without much ado, Dr. Jose, I shall pass the baton to you.
Thank you so much, Melvin, for the very kind introduction. So good morning, good afternoon, good evening, everyone. I think we're very global today. My name is Arnold, and I am a nurse by background, and I'm an educator by passion. So I'm going to be sharing sort of, I would say, some of my experiences as I transitioned from the Philippines to the Middle East and to the United States. And I think I just would like to thank as well Focus Games, AIMS, and Queen's University Belfast for organizing this conferences. I feel like this is a very important topic to be discussed nowadays, especially that there's a lot of global movements for nurses. And I also would like to thank the speakers that presented before me, Professor Latha, Dr. Cara, and Professor Christine, for setting up the stage for this presentation, because I think a lot of the things they've mentioned will sort of be the same as mine, but I'm going to look at it, or I'm going to present it from my experiential vantage point. So for this session, we're going to be looking into understanding the global nursing landscape, which have been presented actually earlier with statistics by Professor Latha. We're going to look at some of the regulatory requirements from different countries, the clinical skills and skills enhancement, soft skills and professional development, and then cultural competence and adaptation, as well as resources and support that you can tap into if you want to move abroad. I just would like to disclose that I don't have any conflicts of interest with the presented materials. Okay, so before I start, I just would like to check in if we are still in there, because I know that I think it's late evening in India, and part of what Milton mentioned is about gamification and making sure that we have an engaging session. So I'm gonna try to do a Mentimeter, which is sort of like a cloud survey. So if you have a smartphone with you, and if you can scan the QR code, or if you can log into menti.com and then use the code 7760489, I would love to hear as to what comes to mind when you hear the term global nursing. Again, you can go to your browser and then go to menti.com, and if you can enter the code 7760489 and key in a term or a phrase that comes to your mind when you hear the term global nursing. So maybe I'm gonna give you like sort of 30 seconds for the interest of time. Okay, so we have answers coming in. Thank you. So global nursing, working abroad, international nursing. Dr. Al, yes, I would consider myself as a global nurse. Solutioning the nursing crisis, definitely. I think there was a mention earlier about the global nursing shortage. And, we are all aware as healthcare professionals that there's a massive need for nurses worldwide in different countries, right? And even in different subspecializations as well. So I think it was mentioned by Professor Christine earlier as well that there's an aging population, not just for nurses working in the clinical area, but also for nurses teaching in academia and even clinical educators as well. So that definitely is related to global nursing. Nursing in the world, yes. Working abroad, skilled nursing, definitely. Comprehensive nursing care, yes. Because when you work with people across the globe, you need to deliver comprehensive nursing. That's definitely one of the things that we need to consider. There is an aging population, definitely related to global nursing as well, because it's what we said, it's not just the patients who are aging, it's also the nurses actually that's also aging. Serving the world, worldwide, generally accepted, nurses everywhere. So thank you so much for your active participation in this Mentimeter. And all the things that you've mentioned here are actually relevant to the term global nursing. But what I've discovered actually is that sometimes, we always think of global nursing as working, because this is the most common notion for global nursing is that global nurses are the ones who are working abroad. But what I've realized is that it's not necessarily true all the time. You can still be considered as a global nurse even if you are working in your own country, because as what we all know, our countries also have foreigners or visitors that come for our service, right? So and a lot of the hospitals, and I just searched in Google just before I started the session, a lot of the hospitals in India as well are Joint Commission accredited. And Joint Commission, for those who aren't familiar, is an international accrediting body from the United States who accredits hospitals that are having policies and procedures aligned with international standards. So I would say that as a nurse, for example, if you're working in a hospital in India who is accredited by the Joint Commission, you can consider yourself as a global nurse, mainly because you are actually adhering, or you're actually practicing in adherence to international or global standards for healthcare. Okay, so one of the answers given earlier was Dr. Arnold. I am a global nurse. I will claim that I am a global nurse. So I am originally from the Philippines. Worked there for a few years in med-surg and critical care units in the ICU, and then I would say that for lack of better terms, it's quite challenging to work in the Philippines as a nurse from the financial side of it. As much as I love working, with my people, sometimes, or I'm not so sure how it is now because I've been out of the country for more than I would say 12 years now. But when I was working as a nurse, the pay for nurses was not very good. And I think that was what prompted me to look for opportunities abroad. And this is when I found out that, there are good opportunities in the Middle East, particularly in the United Arab Emirates. So in 2013, I decided to leave my country and then move to the United Arab Emirates. I initially just planned to stay there for 2 years, but then I think I sort of liked living in the Middle East in a way, because there are a lot of benefits for nurses, and at the same time, don't um, they don't have taxes for your salary, so that's one thing. So moved and lived there for almost 10 years, but then eventually I realized that as much as it's a good place to live as well, there are some restrictions in a way in terms of professional development. So I decided to look into other countries and found out United States, that offers a lot of subspecializations for nurses, because I really wanted to specialize as an educator. So decided to work on my visa and eventually was able to move to the United States. And as I was transitioning from the Philippines to the Middle East to the United States, I've gone through a lot of, I would say, professional development initiatives for myself as well. Because as I said, I'm very particular with professional development and wanted to specialize into something. And I'm really very passionate about education and training. And that is when, I started getting into postgraduate studies that is focused on education. I ventured into certification. So in the United States, and I cannot speak for Northern Ireland or the UK because I'm not very familiar with the process of certifications for nurses, but in the US, there's a lot of certifications that you can go into, that you can have for yourself if you are really very passionate about something, because there's just a lot of subspecialties here as well. So for example, as what was mentioned in my introduction, I am a certified nurse educator because I've worked in the academia and taught here for I think I would say less than a year, and then in the academia, and then eventually transitioned into clinical and corporate education. So I also had my certification as a nursing professional development specialist, which is still an educator, but more on the professional development side for non-clinical nurses. So as I was transitioning abroad, I've discovered a lot of things, and the three main things is that there's definitely vast global career opportunities working abroad, because again, there is a lot of shortage in nursing itself, but there's also a lot of shortage in the subspecializations itself. So as much as there's a need for nursing at the bedside, there's also a need for nursing in education, nursing in infection control, nursing in quality. So again, if there's something that you are passionate about, if it's not present in your country, you can sort of venture abroad and look into those subspecializations that you're really interested in. And then when I moved abroad as well, I've realized that there's actually a diverse international nursing workforce, nurses coming from different countries. And I've had the pleasure of working with a lot of nurses from India. Particularly, I think majority of them are from Kerala. So when I was working in the Middle East, I worked with nurses at the bedside, worked with Indian nurses in the management level as well. And then another thing is that there's definitely a need for upskilling to succeed in a global context. And I think a lot of those things have been mentioned earlier already in terms of what are the things that we have to consider in terms of, like getting your postgraduate or your continuing education, for example, or upskilling your language proficiency. But in a way, I think one of the things that was mentioned earlier by Professor Latha and Dr. Kara is that Indian nurses are very well prepared to move globally just because the curriculum is really aligned. For example, and I cannot speak for other countries again because my experiences are mostly with UAE and the United States, but I know that even for the Philippines as well, our curriculum is sort of aligned with the US. So when we come to the United States, we don't even have to go for a bridging course as opposed to some other countries. Because in some other countries, you cannot necessarily practice the nursing profession immediately after passing the exam, because technically you have to, I think, study for a bit to sort of bridge the curriculum differences. And then that will be the time that once you have done the bridging course, then that will be the time that you will be allowed to take or to sit for the registration exam. So for Filipinos, at least, because our curriculum is very much aligned with the United States, what they require for us is to just have our credentials evaluated. And maybe for some of you who have started your application process to other countries, you might have noticed that part of the requirements for that country is for you to make sure that you have your credentials evaluated, to make sure that it's aligned with the curriculum here as for Bachelor's of Science in Nursing. And then they will also look for your English proficiency exams, mainly because we're not a native English speaker. And then some other things that they will look into as well. And for example, for NCLEX, once you have done or once you have, I would say, passed all those, once you have ticked all those criteria, you will then be given the authority to take the test or the ATT. And then once you pass the exam, then you will now be allowed to practice on that specific state. So there's another thing here in the US. Each of the states will have their own board of nursing. So that means that even if you're licensed in a specific state, that means that you can only practice in that state, not unless that is a compact state, which can be for a different discussion. But compact state just means that there are some states who have made an agreement that if this nurse is licensed in your state, they can practically practice in my state as well. Some other states are not members of compact states, so that's why you need, I would say that, especially if US is one of the countries that you're applying to go to, it's always best to really understand which states are compact so that you can just move around those states, or which state is very particular with their own license, and that before you can practice to another state, you have to have your license endorsed. So understanding the global nursing landscape, I think, have been covered earlier. There was statistics presented by Professor Latha in terms of, and Dr. Kara in terms of the migration of Indian nurses and nurses in general, across the globe. And if I remember it correctly, I think there was forecast in the report from the World Health Organization that there's hundreds of thousands of nurses needed in the United States alone. So you can just imagine, if the United States needs those nurses, other countries will be needing a lot of nurses as well, which would mean that there's a massive need, millions of nurses across the globe. So one thing to consider, and this is again based on my experience, is that when you want to move to a different country, you really need to do some research and understand what are the nursing practices and standards, because it can differ from country to country. So if you want to go to the UK, for example, the requirements are different. There were mentions earlier about OSCE, about bridging courses and stuff like that. In the United States, again, I think because for us, India, Philippines is aligned with the curriculum of the United States, so you just have to sit for the for the NCLEX exam, couple it with your English proficiency exam, and then once you pass, then you can practice. It might be a bit different in European countries as well, and maybe in countries in Asia, because I think like Singapore and Japan are also for Filipinos. These are also countries that many Filipino nurses would want to go to because they pay good salaries for their nurses. Another thing to consider is that when you move abroad, there's definitely diverse healthcare systems. Some can be private, some can be government, some can have universal healthcare systems, and that can impact the way you perform your practice as a nurse, right? The requirement of the role. And yeah, it might be a bit different in India as well. It might be different in the Philippines. So before you venture into moving into a different country, it's always good to be very familiar with the healthcare system so that you know what might be your scope of practice. Because in our home country, and again, I'm speaking as a Filipino nurse, there's a lot of differences on what I can do as a nurse, and maybe because that's part of the differences in the healthcare system itself and the different nursing roles. So, for example, here in the United States, you can actually become a nurse practitioner, wherein part of your scope can be prescribing some medications or providing specific interventions that a regular nurse cannot do. Okay, so this is where there is variation in the nursing roles, and this is where certifications and further education can play an important part on how you practice nursing abroad. again, there's key differences and similarities in nursing roles and responsibilities. I think one of the speakers mentioned earlier that nursing generally is the same across the globe, right? But then it needs to be contextual in a way that, yes, we practice nursing, but then nurses or patients in the Philippines might need a different approach in terms of nursing care as compared to patients in the United States. And that could be different, again, on different countries. So you always have to consider your scope of practice, very important, especially if you work abroad, right? Our licenses are privileges. So if you perform something that is out of your scope, that privilege can be taken away. And you would not want that to happen to you, especially that it's not easy to actually obtain a license abroad, and like to even transition from your home country to the United States or to other countries. You spend a lot of energy, a lot of effort, a lot of finances, actually. So that's why every time, I help Filipino nurses transition from the Philippines to the US, I always tell them that we have to be very particular with understanding our scope of practice, because in many countries, and especially in the United States, I would say majority of the patients are very familiar with their rights as well. And if you perform something that is against their rights, or if you perform something that is not within your scope of practice and the patients know, you can actually get sued, and you can lose your license. And of course, collaborative models as well. So one thing that I've realized, as a Filipino nurse, when I started in the Philippines and then moved into the United Arab Emirates, the structure or the care model is very different. So in the Philippines, we usually have the physicians as the lead person who will decide for patient care. Here in the United States, it's very different, because me as a nurse have the autonomy to actually speak up. And I would say that a lot of my team members are also depending on me, on the information that I provide to the team, because technically nurses are the ones who are in front of the patient majority of the time, right? So there's really a massive push for collaborative models here. And for example, one of the regular things that we do is we have grand rounds or patient team discussions, when we talk with the patient as a team, with the physician, with the nurse, with the dietitian, the pharmacist, the occupational therapist, everyone that is part of the patient care. And then we discuss as to how we can collaborate in providing the best care for the patient together with the patient, so that, the patient knows that we are actually really planning something that would be very beneficial for the patient. And then there's also the importance of cultural competence in global nursing. So it's very important for us to understand that, as much as nursing is generally the same, people from different countries have different cultures and therefore expect different types of care in relation to their culture, right? So for example, when I was working in the Middle East as a male nurse, part of their culture is males should not be touching females, right? So as a male nurse, I was not allowed to take care of female patients. But then female nurses can actually take care of both male and female. So that is sort of like cultural competence there, or cultural sensitivity. You need to know what is present in the culture so that you can provide a culturally sensitive care. And of course, there is an emphasis on patient-centered care. So when we provide care, we need to make sure that we really provide what is needed by the patient. It's not what we think is good for the patient, but we need to have that conversation as to what really matters to the patient, right? So another thing that was mentioned earlier as well is navigating regulatory requirements. So as what we've mentioned, there's a lot of requirements, and there's varied requirements from different countries, and sometimes it can even be state specific, as like here in the United States. So first is you have to understand the licensing and certification requirements in different countries, especially in the countries that you are aiming to go to. It can be a bit different if you want to go to Singapore, Japan, UK, European countries, United States, very different. You have to understand how it's structured, what are the requirements, because then it will help you navigate that process smoothly. And if I have to be honest, having when I was processing my license for the United States, it took quite some time, because, for example, the state that I applied, Massachusetts, because I'm currently based in Boston, the state of Massachusetts, their Board of Nursing has a lot of requirements in terms of validating your credentials, your academic credentials, for example, your previous licensures from the countries that you've practiced nursing. So I have to go back to my country. I mean, like, I have to go to the board, the board of nursing in the Philippines, the board of nursing in the UAE, to make sure that I have proof that I actually practice nursing in those countries and I am a nurse of good standing. And then another thing is navigating diverse certification criteria. So many countries, for example, I would presume, requires everyone to be certified as a basic life support provider, right? And sometimes this certification can be even more stricter in a way that they want a BLS certificate that is provided by the American Heart Association. And I know that there's different associations in different countries that provides this basic life support certification, but one of the most commonly known, for example, is the one from AHA, right? So you have to look into those, pay particular attention as to what is required, because you might have that certification, but if it's not accepted or accredited or recognized by that country, then that might hinder your ability to apply for licensure and certification. And then, of course, we need to look into the strategies for meeting regulatory standards and qualifications. So tailoring education and training is very important. So again, I don't think that will be much of a bigger problem for Indian and Filipino nurses, mainly because our curriculum, I would say, is really aligned with the US curriculum, but then I do not know how it is aligned with other countries. What I've heard, for example, is in Canada, our curriculum in the Philippines is not necessarily fully aligned with the Canadian curriculum. So that's why many of the Filipino nurses who wants to go to Canada have to go for, I think they have to study for a year or so before they can sit for the licensure exams in Canada. And I've heard sort of the same story in the UK as well, in other parts of the globe. Like in the UK, you need to, I think, do a bridging course for 6 months or 12 months. I could be wrong because I haven't really explored it, but that's what I've heard from some of my friends who have moved in there. And that is, I think, once they complete those training, then that will be the time that they can sit for the licensure exam or the OSCE, for example. And then, of course, another thing is to engage in continuous professional development. So I would say, I think a lot, or if not all, of the countries are actually requiring us to have continuous professional educational hours, right? So even in our home countries, like for me as a Filipino, to renew my license, I have to maintain a specific credit hours for continuing education, and sort of the same here in the United States. So that's another thing. Like if you want to go for licensure or certifications from other countries, for example, US-based certifications, they will be requiring a specific number of hours that is aligned to what specialty or certification you want to get. So, for example, when I applied for the Certified Nurse Educator certification, or the CNE, because this is a US-based certification, and during the application process, I was still working as an educator in Dubai. So they asked for a proof that I was working as a clinical nurse educator, the number of hours that I'm teaching in the clinical area and the number of hours that I was teaching in the academia. So I have to provide some proof of those experiences. Okay, so those are some of the things that might be required if you want to go into specific certifications. And then another thing to consider is transnational credential recognition and licensure endorsement. Again, it has been mentioned earlier, our curriculums are aligned with majority of the countries in the West. We might just need to have some bridging courses for some other countries who does not necessarily, who I think identifies their curriculum as maybe like a semester less than how their home country curriculum is delivered, and that is where the bridging courses are required. But many countries or like, again, in the United States, they do recognize Indian and Philippine curriculums. What usually happens is these degrees, for example, or transcripts are being evaluated by some accredited bodies. For example, if you're familiar with CGFNS, CGFNS, they look into your qualifications, and then they are the ones who provide certifications that, oh, this nurse applicant has a recognized, accredited, or equivalent curriculum in the US, and therefore is allowed to practice in the United States, and therefore you can provide them with visa. So you might have heard of like visa screen certificate, right? So this is part of, even for the visa screening, they would require an evaluation of your credentials. Another thing to look into is the licensure endorsement processes. So here in the United States, is what I've said, different states will have a different process for licensure and certification. And if they are not part of the compact states, for example, if from Massachusetts, I'm not part of the compact state and I would want to practice in California, I need to have my license endorsed to California. And that's a different application process, but it will be easier because it's not like you're starting from abroad to the US, right? It's like from one US state to another US state. And of course, you can utilize support resources. So I think with the advent of technology, it's quite easy now to search things in the web, and you can definitely tap people who have gone through the experience. I myself, I am currently working now as the director of clinical education in a staffing company, and we are helping nurses from the Philippines transition to the US. So I sort of become their one of their support resources for those Filipino nurses when they ask something in terms of what they need as they will transition, because I have gone through the process. So if you know anybody, for example, from India who has been successful in other countries, aside from the resources that you can get from the government, which I feel is very robust, actually, then you can definitely tap onto those people and those colleagues and ask for their help and guidance. Clinical skills enhancement, of course, is very important. Again, as much as everything is, or nursing is generally sort of the same, it has to be specific with the patient population that you're going to be taking care of. We have to identify and address gaps in clinical skills. So, for example, what we have done now in my organization is that when I came into the organization, and as a nurse who has gone through the transition, I've identified that there is a lot of gaps in terms of electronic medical recording system, for example, because we don't have a lot of EMRs, or we do have some EMRs, but not as integrative as here in the US. So one of the trainings that I have put in place before the nurses comes here in the US is the EMR training for them in the Philippines. So we've stood up a training facility in the Philippines, and for those nurses who decided to go through our staffing company, we make sure that they receive a 16-week training of clinical upskilling for everything that we feel would benefit them as they come to our hospital partners here in the United States. So what we usually do is, of course, we do a skills assessment. We try to understand what their baseline skills are, and then based on that, then we tailor fit some of the sessions. But there's the generic standardized sessions, and then we just add on some sessions that are tailored to what the training needs are. Of course, we adhere to clinical competency frameworks for us to really understand, what is the level of competency or proficiency of this nurse, and for us to sort of inject some of the interventions if we feel that they are at the specific level, and how can we bring them up to the next level so that they will be able to function competently and confidently as they move here in the United States. So some of the educators who are here might be familiar with Benner's novice to expert model, wherein there are 5 different levels of proficiency of the nurses. So, for example, as an Indian nurse, I'm sure that you will fall within the competent, proficient, and expert levels when you are caring for patients in India. But once you move to the US, because the setting is very different, sometimes you might go back to the advanced beginner stage. And that is when we inject our international transition to practice program, which is the 16-week training curriculum, so that we can upskill those nurses. And maybe this is one thing, because I think Dr. Kaura mentioned earlier as to how countries can collaborate. This might be some of the things that can be considered, if the government of India will partner with staffing companies, for staffing companies not to just bring nurses out of the country, they need to give back. And this is one way of giving back, training their nurses ahead, and also sharing those training resources within the nurses who would want to stay in India, so that they can have they can be upskilled in a way, and there's an exchange of knowledge from outside to India. Continuing education and training options for skills development. Of course, we have formal education programs. For example, what Professor Christine mentioned earlier, that they have like degrees, a master's entry level, for example, that you can get from different parts of the world. Clinical simulation and practical workshops. This is what we are also doing in the training facility that we've stood up in the Philippines. Again, because we know that not many of these nurses have experience working with an American patient or an American setup. So we brought in some high fidelity mannequins, mannequins that can talk, mannequins that have pulses, that can breathe and stuff, so that they can practice working with them in providing culturally sensitive care. And then, of course, we have online learning platforms. This is a very common platform nowadays. We have a lot of modules that nurses can actually go into, get trained, especially, I think, during the advent of COVID, when majority of the trainings was put online. And of course, the strategies for building clinical competence and adaptability. Very important to set up clinical preceptorships and internships, to provide experiences for internationally educated nurses, for example. I would say, like, one of, I think in the US, again, I can speak for other countries, like there's this student exchange program, so that nurses from, or student nurses from other countries can come into the United States and experience how it is to be working here. And the same goes for US-based nurses, actually, to also go into different countries and also see how nursing is being delivered in those countries. Cultural competence in clinical settings, again, very important, because we need to deliver culturally sensitive care depending on the needs and depending on the culture of the specific country. And then professional mentorship programs as well. So I think this is very important because, as what we said, there's an aging population of nurses, and the only way for us to train the next generation of nurses is through mentorship. But I think for the new generation of nurses as well, I'd strongly encourage all of you to really ask to be mentored by the seasoned nurses. And I know there's a lot of nuances in terms of how these different generations of nurses interact. Like in my home country, for example, during my time when I was working there, there's this concept of old nurses eating their young nurses. But then I think it has changed over time, and there's a more open communication between the younger generation and the older generation of nurses. Soft skills and professional development, again, very important. If you want to succeed globally as a nurse, there's there's an emphasis here on effective cross-cultural communication and empathy. Very important. Again, when you want to move into a country, different country, just be very familiar with their culture. And you don't have to necessarily change your culture because you want to move to a country. Doesn't necessarily mean that. You just need to integrate. And by integrating, we mean that you can still bring your culture in, but then also be sensitive to their culture. So, like, for example, again, as a Filipino nurse, my culture in the Philippines is that we can take care of the different genders of patients. But then when I moved into the Middle East, I know that their culture is, very gender specific. So I made sure that I was very particular in that because I want to be respectful. Okay. And then language competency, very important. Again, if you're going to be moving into an English speaking country, then might not be very challenging for you because we can communicate in English. But if you're moving, for example, one of the challenges that I had when I started working in the Middle East is I didn't know how to speak Arabic. So I had to learn it. And I didn't even really get to learn the language itself, but I really tried my best to learn some of the conversational phrases that I use, and like, for example, in the Middle East, it's very common for them that when you talk to someone, you start with greetings like assalamu alaikum, or peace be with you, and then you have to respond walaikum salam, and then kif halik, how are you, and then that is usually how the conversation starts. So you need to sort of understand that for you to be culturally sensitive and culturally competent in delivering the care, you have to at least have those basic foundations. Adapting to different healthcare systems and practices, as what I've mentioned earlier, there will always be differences in how your healthcare system is in your home country and in the country that you're going to be going into. So make sure that you attend orientation programs. And I think this is one thing that you need to ask, when you're going to be working abroad, and when you're applying for abroad. How long is your orientation programs? What are included in your orientation program? So you should not go into a country blindsided just for the sake of like going abroad. You actually have to really explore if you will be well supported when you come here, or when you come there to that country that you want to go to. Also look into interprofessional collaboration. So again, as a Filipino nurse, I was never very assertive when I was in the Philippines, because most of the time in the Philippines, we usually just say yes to the doctors. It has changed when I moved to the Middle East. Although in the Middle East, sometimes, there's still a hierarchy in terms of the care model. But in the United States, when I came in here, like, it was very different, because like, they will really give you time to talk as a nurse, and even the doctors will ask you, like, Arnold, like, what do you think about the patient's condition? Like, what can we do? So it's really a discussion, and there's really a collaboration with your team members. And again, cultural intelligence, knowing the culture that you're going to be working in, and adapting to that. And cultural intelligence with your colleagues as well, knowing when to talk, knowing that you actually have the opportunity to talk and advocate for your patient. And of course, lifelong learning and career advancement opportunities. So in many countries, I would say it's the same, in our home country, in our home countries. Sometimes we might not use those, because sometimes we always think that, there's other career advancement opportunities abroad. But there's definitely continuing education pathways. Again, here in the US, very particular, they're very into subspecialization. So you can be a nurse anesthetist, you can be an infection control nurse, a nurse focused in quality, an wound care nurse. So a lot of things. Participation in professional organizations. So very important as well to also make sure that you have a professional community. So for example, I know that I think in US, there's this if I'm not mistaken, I think Indian Association of Nurses in America, or something like that. In the Philippines, or here in the US, for Filipinos, we have the Philippine Nurses Association of America, for example. I am also part of the Siena group, which is the Society of Internationally Educated Nurses in North America, wherein we have members from different countries. So yeah, it's very important to be part of professional organizations. Mentorship and coaching, very important as well. As what I've said, ask nurses who have been through that process, who have that experience, ask them to mentor you. When I started in my career, I thought that getting mentored is a sign of weakness, because sometimes we feel like, if I need to mentor, then that means that I have a weakness. But what I've learned is actually mentorship is really amazing for your professional development, because you have nurses who have those rich experience and expertise that can actually share with you how they achieve that, for example, or how have they managed the adversities and the challenges as they transition to that role, for example. So I would say, if you're not into mentorship and coaching, I think this is a time that you need to start looking for mentors and coaches. And of course, utilizing your online learning platform. So there's a lot of platforms that we can utilize nowadays. A lot of the information actually to succeed in our career is available online. Cultural competence and adaptation. I know that this is mentioned earlier already, but understand and respect cultural differences in healthcare. As what I've said, be very particular and know the culture of the country or the state or the place that you plan to go to if you want to work abroad. And of course, you can achieve that through cultural awareness trainings and recognizing health beliefs and practices. So a lot of this information are really available in the internet. So I would not say that it's very difficult to get this information, but it does take time, looking for the right information. You need to have some strategies for cultural adaptation and working within diverse healthcare teams as well. So again, cross-cultural communication skills, very important. As what I've said, as a Filipino nurse, I was not assertive. So I have to learn how to become assertive, how to speak up on my behalf and on my patient's behalf, so that I can advocate for my patients. Cultural competence in team collaboration. Sometimes people from different countries might appear very strong in terms of how they communicate, how they work with the team. So you also need to understand how to approach or how to, for example, not to be offended, because like sometimes Asian culture, sometimes we might be easily offended when people speak on different tones, but maybe that tone is normal for that specific country, right? So these are some of the things that we need to consider. And of course, conflict resolution in diverse teams. So again, if and when you are able to understand the different cultures, sometimes it will be easy for you to avoid conflict once you have that cultural understanding, because you will be able to adapt and integrate within your team. And of course, we need to build a globally inclusive healthcare environment. As what I've said, when I worked abroad, there's really a diverse workforce. Worked with nurses from the US, the UK, from India, from the Middle East, from Jordan, for example. A lot of nurses from different parts of the world. And I know that hospitals hospitals abroad usually have this diversity and inclusion policy to make sure that we do not discriminate people from different cultures, especially internationally educated nurses like myself. Promoting cultural competence at organizational level. So there's definitely a lot of training that goes into promoting cultural competence for nurses coming in, and even for nurses who are already working there. So for example, one of the hospitals that we've partnered with in Washington State, they really get into the level of like even understanding what are the food that our Filipino nurses love to eat, so that they can include that in their cafeteria, for example. So that's one of the things that some of the organizations are really doing, to really sort of cater and also respect the culture of the people that they are bringing into their organizations. And of course, community engagements and partnerships. So this is where the organization memberships is very important, because you need to be engaged in the community, because you can actually get a lot of information from those organizations and from those communities. So even myself, like I'm really very active. I'm a very active member of the Philippine Nurses Association here in New England area, where Massachusetts is. And I've learned a lot from the Filipino nurses who are here. And one thing that I've really noticed is that they're very open to helping the newcomers to the US. And I would presume that will be the same in your culture, because we love to help each other. So really lean on to those people who have those experience. And then I think this is my last slide on resources and support. As what I've said, you can get a lot of resources and support from different organizations and programs that support internationally educated nurses. One thing that I would really encourage you to reach out maybe to is your professional nursing associations in that country, because I'm sure that there will always be those professional nursing associations. And of course, you can look into the websites of the government agencies and regulatory bodies, because they should be able to have some guidelines and they should be able to provide some information on what support you can get. Mentorship and networking opportunities for global career development. So it can either be a formal mentorship, it can be an informal mentorship, just messaging someone. For example, if you're active in LinkedIn and you know that there's this Indian nurse who have thrived in Europe or in UK or in the US, ask them as to, you want to go to the US, what are the tips that they can give you? And you can start having that discussion. Online networking platforms, social media is a very good resource for now. And again, I would say LinkedIn is a professional platform, so it's a very good platform that you can use to network with other professionals. And even local networking events, conferences like this, you get to meet people from different countries, which can be a good resource for you. And of course, different organizations, especially here in the US, they really have allocated budgets for scholarships and financial support for further education, particularly for internationally educated nurses. So what I would suggest is that if you're looking into continuing your professional development, looking into postgraduate courses, for example, go into look for schools that you are interested in, and then check their websites. There will always be a section on their website that talks about the scholarships that they provide, or the grants and financial aids that they will provide for internationally educated nurses. And some of the employers here, I've noticed they are very supportive in terms of professional development. So sometimes they might sponsor education assistance through tuition reimbursement. Okay, so that ends my session. Thank you so much for your kind attention. I hope I was able to impart some generic knowledge on how you can thrive as a global nurse across the globe.
Thank you, Arnold. Really appreciate that very in-depth and comprehensive. So I think that's added a lot of value to our audience. Joseph, I think we have time for just a question if we've got one there.
Oh, yes. Hi, Arnold. Few questions for you. Where do we get information about whether the specific certifications are approved by the states?
So it varies from state to state, because sometimes they would have some recommendations in terms of what organization can review those credentials. I would say CGFNS is one of the most commonly used organization, at least here in the United States. I couldn't speak for other countries. Some, if you might have heard of WES, or I think it's West Worldwide Evaluation Services. There's another platform that you can also use, and actually in their website, you can actually check whether your degree is equivalent to a specific country. So I would say that those two are the most commonly used platforms or organizations.
Okay, thank you, Arnold. One more question. I think this is from a student who is preparing for NCLEX. How to practice best for scoring well in NCLEX exam?
So I would presume that this nursing student is familiar. There has been a change on the structure of NCLEX exam. I would say that I think the best way to prepare is first to do a self-test to assess which area of NCLEX are you weak and you're strong, and then focus more, of course, on the areas that you are weak, because NCLEX can be very broad, and of course it can be very stressful to prepare for it. And be familiar, do some test taking technique practice, because again, I think there's like 5 to 10 test types now. Before it was mostly just multiple choice, and select all that apply. So now it's very case-based scenarios now, and some other things that you do.
Great.
Okay,
thank you.
great, thank you.
There's a lot more questions, but I think we just have to hold on them. I think what I might do actually, Arnold, is pull some of those questions together at the end, and maybe drop you a quick email to see if we can give any sort of specific response. Then we'll post those to delegates so that they've got all the questions answered. But once again, really appreciate you coming and presenting today, especially on the Thanksgiving Day. It's a big holiday in the US, so I really appreciate that.
Thank you.
So I'd like to introduce our next speaker, Jeffrey Roche. Jeffrey is a healthcare executive, 15 years experience, leading across functional teams across all aspects of healthcare operations in North America. He is the son of a nurse, healthcare expert, diversity advocate, and education enthusiast. Presently serving as inaugural director of workforce development at Siemens Health Linears and National Health Care Practice Executive Advisor at Core Education, PBC. Jeffrey often speaks on healthcare workforce topics at national conferences such as Becker's annual conference. So I will just check if Jeffrey's there, if your camera's on. Perfect. And in 1922, Jeffrey was nominated for the Forbes Business Council for his national level work, and he's over 9 years experience in hospital administration, has led leadership positions at various universities in the United States. So Jeffrey, we welcome you, and we're looking forward to hearing what you have to say.
Thank you, Melvin. And Melvin, can you see my slides?
I can indeed, thank you.
Okay, great. Well, good morning, good afternoon, good evening to you all. And let me just say that mine will be the most non-academic presentation of the day, which for those of you that are in the academics understands that means it'll also be less in time. So let me just share with you what I consider to be really important for all of you as you consider not only your role as a nurse, but also your role if you should come over to the United States or go abroad, wherever you may choose to go. As referenced, I come to you as the son of a nurse, and I come to you as somebody that has worked at the highest levels of our healthcare system in the United States and served with a nurse CEO. And so I've also understood what it's like to work with a nurse leader that transforms a healthcare system and ultimately through that work transforms a community. As I share this with you, I think what's really, really important is to understand the power of your personal brand, your identity. And so all of you are a nurse. All of you bring incredible skills. All of you bring passion, and all of you bring yourself into this work. But what we often find is that nurses don't always speak about that as eloquently and as profound as you need to. You are special. What you offer and what you contribute to the profession is by far the most important out of all of healthcare. And even if there are any physicians in the room, I apologize in advance. But the reality of it is that nurses are the backbone, and nurses are also literally the angels of healthcare. And so how you articulate your personal brand is really, really important. And so I want to encourage you to go here to Menti by taking a picture like you did for Dr. Arnold, and enter this code here, because I want to hear from you as to what you and how you would describe specifically in one word your personal brand as a nurse. And I want you to do that because what's really, really important specifically about that is oftentimes how we hear that and how people describe it is very different. And so I want to encourage you to do that as we speak, and hopefully we'll see some responses and thoughts as to how you would describe your personal brand. And so we're seeing some here. We're seeing leader, change maker, empowered. We're seeing some numbers, which, hey, if that's how you describe for those that are more arithmetic oriented, that's really good as well. Neuro, trauma, ICU, self-marketing, making people know you, personal identity, quality, some really, really good aspects here. Holistic care, another really, really good one. My favorite, not that I choose, but I love to see leader, particularly because you will hear me speak as I do globally. All nurses are leaders. Doesn't matter whether you have the title, you are leading care, you are leading value, you are leading quality, you are leading every aspect of our healthcare system. So really, really good ones to take note there. So as we continue, what is so important as you consider your personal brand is thinking about it from the process that all of us bring a unique aspect into the workplace, whether we're serving in a care setting, whether we're a nurse entrepreneur, whether we're a nurse educator, whether we're a nurse that's leading quality. We all have some aspect of a unique professional quality and identity that sets us apart. And so it's not about a logo. It's not about a tagline, but really, most importantly, it's about your reputation. It's about your skills and your values. What you contribute, what you bring sets you apart each and every day. And you see here in this image that it's also about strategy. And so many nurses say, strategy? I'm not a strategist. Yes, you are. Every day you think about how to make a patient's life better. Every day you think about how to make our healthcare system better. Whether here in the United States, in India, wherever you may be, nurses are the drivers of all aspects of that. And so why I think it's so important about this, particularly in nursing, is as somebody who's taught nurses at the graduate level, not clinically, as you would imagine, because I'm not a nurse, but I've been a leader and been an administrator in both higher education and nursing programs on the cabinet of many universities, as well as at the hospital systems in the United States, and now leading workforce development for Siemens Healthineers, a global company, is that nurses generally don't view themselves as leaders. And that always has pained me as the son of a nurse. I served at the same hospital that my mother served at, different times, as you can imagine. But what I got to experience as the son of a nurse at that same hospital was that my mother led initiatives, was part of initiatives that I got to be a part of. For example, she was a nurse in the NICU, a labor and delivery nurse for 13 years in that same hospital, and ultimately helped develop that NICU. And guess what? I was part of a team later on in life that got to grow the NICU and advance it to another level. Imagine that experience, to see not the fruit of not only my mother's labor, but an entire team's effort. And so why that branding is important is that if you look in the healthcare profession, nursing is the largest organization, at least in the United States, probably globally as well. Among all organizations, the largest number of professionals hired, the largest number of professionals in an organization are nurses. Nurses are always generally also the ones that advance more. And we know, at least in the United States, record every year, patient trust and relationships. Nurses are the most trusted profession every year in the United States in healthcare, always beating out doctors, always beating out everybody, especially executives in healthcare. So mind you that. And also, generally, we want to remember the power and the importance of a growth mindset, because when we have a growth mindset, nothing is out of our reach. There's a few things that I think are also important. Our professional appearance. And what I mean by that is that, not just because you're a nurse doesn't mean when you go out, when you speak, when you attend things means you've got to wear scrubs. You choose how you want to look. And I'll show you some examples of that from a LinkedIn presence. We have to remember that nurses are everywhere. It's not just about inpatient care. It's about post-acute. It's about home health at home. It's about entrepreneurship, where nurses are creating some of the most transformational startups in this world today. It's so much more than just inpatient care. It's about being a professor, being an educator in all that you do. But also our skills and competencies, which we've talked a lot about today. So I don't have to speak much more to that, but I want to also speak about our values and our ethics, because we are seeing this as a very significant challenge globally. This very issue around values and ethics. We know that back in the day of Florence Nightingale, values and ethics has been at the foundation of nursing. And our hospitals have not always supported our nurses when it comes to this issues. And so I highlight that because you must stay resolute in your values and ethics. And if you're ever part of a healthcare system that's not valuing you, not demonstrating their appreciation for you, you let me know and we'll figure out how to solve that. And then we get to the networking and relationships. There is nothing more important today than the power of networking and your relationships. As you heard many other speakers talk about, everyone starts somewhere and you end up in a very different place. But what's important around that process is the connections, the authenticity that you bring to build those relationships and sustain your professional brand. That online presence, you heard Dr. A speak about LinkedIn and other professional platforms. I cannot emphasize enough the importance of every single nurse having a compelling LinkedIn profile, especially if you want to grow further in your career. Sharing your unique voice, your unique experience can help another nurse, can help another person. That power is not only about personal branding, but it truly speaks to professional branding, and it also speaks to education. And so important. I don't share this with you as I am Mr. LinkedIn. The reality of it is that I am on this LinkedIn journey just like so many other people. And my journey started many years ago. But what's most important about this journey is not the followers that I have, but what I get to contribute in this amazing community of voices, an amazing community around this. And so you will see that I'm a person that believes very strongly in this. And you see, I go by the tagline Heart Leader, because I believe that leadership, workforce, culture, and all aspects of an organization can be solved if we focus on meaningful, authentic connection with another person. And so when you say to me, hey, what is your brand? That's an important aspect of my brand. But you see, I go a step further. The first thing I say is I'm the son of a nurse, because yes, my mom is awesome. She's the most amazing person in my life and always will and always has been. But the reality of it is that I say that also because I have seen organizations transformed by nursing leaders. And so I want to make sure that people know, first and foremost, there is no profession that I'm ever going to relent in supporting than nursing. But I'm also a people connector. That is something that I truly care about. Dr. A didn't tell you, but I'm the person that connected him to his job. I don't say that because I expect anything out of that, but that's the reality of who I am. I get nothing more back than connecting people to an opportunity or something that can help them. But I'm also someone that contributes in the future of work and education. And I'm also someone, as you see, is very passionate about leadership. And you will always see me speak about and advocate for diversity, equity, inclusion, and belonging. These are some amazing friends of mine, also nursing voices. And there's others. I didn't show all examples, but I want to point this out because if you don't follow these three individuals, I would. Christian was supposed to be with us, but he had to work in the cath lab this morning, saving lives at Advent Health in Florida. But Rebecca Love is a global nursing voice. You will see one of the most followed nurses on LinkedIn. She is an amazing voice, just happens to come from Massachusetts. I'm not suggesting that there's something special in Massachusetts since Dr. A and her are from the same state at this point. But what is important is how she contributes. Follow her. you will see her voice, and you will see she speaks. Not only is she a top voice on LinkedIn, but speaks globally on these issues. Christian came from Italy, went to the United Kingdom as a nurse, and then came over to the United States. So we're so glad to have him here after he spent time as a nurse in 2 other countries. But follow him. You will see his focus is on the mindset nurse. What is it like to be a nurse innovator, nurse entrepreneur, and somebody that focuses on personal development? And then you heard from Dr. A, but Dr. A is humble. He hasn't really told you a lot about him. And what you'll see when you follow him is that he's one of the most followed and most respected voices in nurse education globally for the work that he has done. And so really, really important to follow these 3 nurses. There are others. I would follow Dr. Bonnie Clipper, another person. And I just want to say that it's amazing to see the voice of nurses on LinkedIn. And if you want to also follow all nurses, just use the hashtag nurses on LinkedIn, and you will see a lot of exciting conversations. I want to encourage you to showcase your achievements, your successes. Share who you are. Use visuals, share images. Don't ever sit back and think, well, I've got to be humble. It's not about being humble. This is about sharing your achievements because they are profession achievements that contribute to the field of nursing. And nurses have far too often been humble. And guess what? The rest of the healthcare industry is not so humble. And so stop being humble and start celebrating all the amazing work that you do, because you are awesome. Your branding challenges are always going to be there. I'm not a marketer. How do I tell my story? The reality is, be authentically who you are. Talk to us from your heart. Tell us what makes you most passionate. If it's patient care, tell us that. If it's quality, tell us that. If it's advancing health equity, talk to us about that. Whatever it may be, focus on that brand. And then, you know, some of the things you've heard others from our phenomenal speakers prior talk about this, from professional development to networking to resume, portfolio. You'll also hear me speak about you can never do enough continuing education, but those are an important aspect of your toolkit. And then finally, let's connect on LinkedIn. Happy to connect with any of you. Happy to introduce you to any of those leaders I spoke to before. Happy to share this journey with you. Thanks again for all that you do. And as well, thank you to all of our speakers and certainly Focus Games and my dear friend Joseph for certainly the opportunity to be here with you. I just want to highlight again how important all of you not only are to your patients, but also from our society, how important nurses are to all aspects. So thank you for everything.
Thank you, Jeffrey, and I really appreciate you taking that as your topic, because I think it is very important to remember the whole rounded skills that you need, which is not just about your clinical skills, but actually about other things that make you who you are, and it's very important to remind us of that, and particularly in our professional career. So thank you for that. Joseph, was there any questions? We'll take time for I think just one or so before we move on to the last presenter.
Yes, one important question. Hi, Jeff. It was a great presentation. Nurses are heavily stressed due to worker shortage. How can nurses cope with this stress mentally and professionally?
Well, you know, this is, as we know, probably one of the most crisis points that we're facing in the workplace as a whole. Mental health is the #1 issue facing all workplaces. And we know that our nurses have been unfortunately have and always will be on the front lines of this. So the first and foremost thing is there's a lot of work that we've got to do organizationally. And so you will hear me say leaders are responsible for this very issue. They've got to have a culture focused on addressing these issues right away. Secondly, for all of you nurses, you have to recognize this is where the power of a virtual and a networking community can come in. You've got to have people that you can call on to talk about these issues, but not put yourself in a situation where you're fearful of issues in your organization. You've got to have that support unit that you heard Dr. Arnold refer to before that can wrestle this with you. The third thing is, I can't stress enough that yes, you are a lifesaver and you're a caregiver, both personally and professionally in many cases. But you can't do that well if you don't take care of yourself. And so while you may only get a little bit of time a day to do that, Focus on your mind, body, spirit. Meditate if that's your choice. Exercise if that's your choice. I yesterday ran a 5K. I ran it in the fastest time that I've ever run in my life. But why did I do that? Because I know it's contributing to my mind, which sometimes is crazy, but it's contributing in a very positive way holistically to who I am. And then fourthly, if you're in an organization where you truly are not feeling that they are appreciating you for your mind, body, spirit, for your mental health, if they're not providing those safeguards, let's talk, because you've got to get out of that. If you cannot have a healthy environment, none of us are going to be in a position to take care of one another. And so this is an issue, but organizationally, this is where leaders have to foster solutions.
Wonderful. Thank you, Arnold.
Thank you.
Thank you, Jeff, for that.
Thanks, Jeff.
Yeah.
Appreciate that. And moving on, I move on to our last speaker of today, Rinku Kalra. My apologies, I might have spelled your name wrong on your invite, so my apologies there. From Occupational English Test, OET is recognised and trusted by healthcare boards and councils in the UK, the US, Ireland, Australia, New Zealand, Dubai, Singapore, and many more. Many organisations, including hospitals, universities, and colleges, are using OET as proof of a candidate's ability to communicate effectively in a demanding healthcare environment. Rinku, I hand over to you.
Thank you. Can you hear me?
We can hear you.
But can you see me?
Are you sharing any slides, or is it just?
Let me see if I can share my slides. Can you see my slides?
Not yet. I mean, there is a square coming up, so it may well be just coming through, or it may be you need to select, perhaps select the whole screen if that's not what you've done already.
Yeah, actually, this is the entire screen.
Okay.
Yeah. It says that it's sharing a screen, so I don't know if you can see it or not.
The slides aren't showing. Are you just working with one screen, or have you got two screens?
No, just one screen.
Just the one. Okay, so it should be coming up. It might be worth just trying to share again, just to see if that corrects it.
Yeah, just give me a minute. Let me do it again. I don't know why I can't. Okay, there's some problem. I'll try again. Till now, my camera was working fine. It's just now it says incompatible. Can you see my screen now?
No, it's not coming up as. You want? Can you? If you send this your presentation to me, I can share the screen if that helps.
Hi, Melvin.
Yes.
Melvin, I have shared Ringu's presentation with you so that you can share it from your end.
Thank you.
That would be great. Thank you so much.
Okay. Okay, let me share my screen now. And that should be sharing through now. Joseph, can you just confirm you can see that?
Yeah.
And if you just tell me when you want to change screens, I'll accommodate.
Sure. Yeah. Hello, everyone. I'm Rinku, and I look after North part of India as Business Development Manager Thank you very much for being here and giving me an opportunity to present today. And I'm sure that till now you have enough of awareness about the international opportunities available to healthcare professionals from India. Can I get the next slide, please? So I'll take you through, on these lines, I'm going to take you through my slides for specifically UK, US, and Australia. So can I get the next slide, please? Quickly, giving you an overview of the vacancies available all over the world. Like it says that by 2030, there will be a shortfall of 18 million healthcare workers, and out of that is 9 million are nurses and midwiferys. So if I talk about the English-speaking countries, can I get the next slide, please? Sorry, I'm going a little quick because there's, all other presenters have already, discussed a lot about the opportunities available. So I think I'm going to take a little fast from here. So there is a global trend where, why these vacancies are there. We know that there are a lot of demand, but why this demand is there? The demand is there because, during this pandemic, we came to know how short we are with our nurses. And again, because of the aging workforce in most of the English-speaking countries, developed countries, I say, and the population is also aging. So we need more and more healthcare professionals to look after. Can I get the next slide, please? If I talk about US on the similar, UK on the similar lines, NHS has already employed 1.2 million people, and obviously they are still looking forward to have more than lakh nurses. If I say in a simpler words, then 1 in 10 nurse post is empty. So every 10th position is empty. So that's a current situation if I talk about. Can I get the next slide, please? US is a similar situations, and why there is vacancies, like 20% of the healthcare workers, left their job because of the pandemic. We know that it was a very stressful time, and when it comes to the healthcare professionals, it was, really a very stressful time for them. That's why most of them, they left their job. 40% of the doctors are over age 65, so they will be retiring very soon. More than 1 million nurses are thinking to take an early retirement because of the, situations they have faced during the COVID. They're now thinking of taking an early retirement as they have overworked during this period. So can I get the next slide, please? If I that's where it's giving us as a result, they would be looking for more and more nurses. So 1.1 million nurses will definitely be required to replace all the retiring, all be retiring nurses. So to fulfill that places, we need more and more nurses. 9% growth is already there in next 10 years, and 15% nurses in US are born overseas. So that shows that the trend is there, and obviously it's going to grow. So more and more they will have nurses from different countries. As I already told, that the reason behind it is like aging population, and obviously most of the doctors and nurses, they are taking early retirement. Can I get the next slide, please? The similar kind of situations we can see in Australia. So shortfall of nurses we can see by 2025, and it will go up to 1.3K in about in 2030. See, the workforce there is less willing to work after pandemic because they feel that it was a stressful time. Where if we so they look for an early retirement, they look for that kind of little relaxing time after working for so hard. There is a decrease in general practices, 15% in Australian cities. Can I get the next slide, please? As a result, we can see that they are, committed to give fund to aging caring, which is to Australian dollar 2.5 billion. One of the, every third nurse is born overseas, so it's they have people coming in from different countries, different, like, whether it's India or Philippines or other countries. So we can see that every third nurse is coming from overseas in Australia. The increased demand, again, it's 39% by next decade for GPs. Can I get the next slide, please? So won't take it like as a conclusion for this. We see that more and more vacancies in the key markets, which is, I say, all the developed countries or English-speaking countries. Obviously, more and more recruitment will be there to fill out these roles, and strong committed to be fund healthcare professionals. So if I combine everything in simpler words, I say that the demand will be high, as Mr. Kaur was talking, like they're already receiving a lot of demands from different countries. And as a professional, Lata was saying that, we are the source country for many of these English-speaking countries to help them with our healthcare professionals, the experts in technical knowledge. And that's where, because we are going to work in English-speaking environment, that's where OET plays an important role. Can I get the next slide, please? Yeah. So OET plays an important role when it comes to prove your English language, and OET is specifically designed for healthcare professionals. Can I get the next slide, please? So our mission is to connect the world to a better healthcare. I go to the next slide, please. With this vision and mission, we have we have this exam for 12 different professions, whether it's dentistry, medicine, nursing. Although the maximum number of candidates taking our exam from India are nurses, then followed by medicines, followed by other professions. Can I get the next slide, please? Yeah. How this is different to the other journal English test. If I talk about writing, obviously in journal English test, you get, writing an essay on any journal topic. It could be maybe, global warming, or maybe, maybe a football game or anything. It could be any journal topic that you will be asked to write an exam. But with OET, if you are going ahead and giving OET, then you may be asked to write a referral letter on the basis of the case notes given. So, this is something that most of our nurses are doing on a daily basis. So they feel more comfortable taking this test because it's designed for them. Now, if I go, or maybe our doctors, so it's for everyone. If whatever they're doing on a daily basis, they'll be writing, on the similar topics. So it's easy for them to understand and feel comfortable with the exam. If I talk about speaking, then speaking is also in journal. If I go for a journal exam and say they'll be doing a structured interview on any journal topic, it could be maybe, your last trip or something like that. But with OET, it will be a role play. So there will be an interlocutor and there will be candidate, and the candidate will be taking an exam as his own profession. So that's why it's comfortable, because that's they're doing on daily basis, and it gives them more confidence to do their speaking. So can I get the next slide, please? So yes, so that's need of the specific healthcare professionals. If we talk like how it is designed and why it is designed. So I told you the requirement for it. So now if I talk about how it is designed. So obviously it is developed by the consultations with healthcare subject matter experts. The test material is actually a replica of your language and skills that you are doing on a daily basis. So plus the candidates will be learning a lot during the preparation of this exam that they'll be using on daily workplace. After doing that, they'll feel that more confident, because whatever they have learned through while preparing for OET, they'll be actually using that in their day-to-day work life. Can I get the next slide, please? Sorry, can I get the next slide? Thank you. So, yeah, so our, no, I think the previous one was the next. Yeah, that's one. Yeah. So healthcare test, as I already said, like this is for, healthcare skill shortages in English-speaking countries, which I've already discussed that there is a huge demand, and because our health will be working in an English-speaking environment, so they have to have a good, this is one way to prove it. Aging, again, that's a requirement. That's the reason why we came up with this exam. So aging population putting a lot of pressure on healthcare system, increasing consumer expectations and focus on patient care, the high cost of communication barriers in healthcare professionals. All these reasons why we came up with OET, an occupational English test for healthcare professionals specifically. Can I the next one, please? Thank you. If I talk about our presence, we are globally present, and there's like we are take exams, so the secure availability is everywhere, and we are, as I told you, that we are globally recognized in most of the English-speaking countries, and we are also, if I talk about the support to the candidates, then we have a lot of material and team to support our candidates to do their best in exams so that they can have the desired score in the first go. Can I move to the next slide, please? And next one. Thank you. I can't see anything. I think the piece is gone slow. Yeah, as I said, we are internationally accepted. So we are recognized in US, Australia, New Zealand, UK, Ireland, Singapore, Dubai. So if you're thinking of any of these countries, then we are well accepted. I move to the next one, please. When I'm talking that we are, a global exam, so we have test venue, more than 380 test venues in 70 countries. We are available, like delivery boards are paper-based, computer-based, and home-based. So these are the three different modes that our exam is available for. So you can choose whatever is more comfortable to you. Can I move to the next one, please? Yeah, next one. Thank you. When I talk about like why a candidate should take OET, so listed a couple of examples for that. So we are, registered with healthcare regulators, which I've already shown you. To get a better job, yes. If you have the desired score, that is requested by any of the destination country, then you have that, you have proof of your English that you are eligible to go there, and then you can move forward with your plans. Obviously, we have, why they take, why we get so many candidates without even, how I say, we have this fast growing growth. We have a referral, a lot of candidates come to us through the referrals, where if a nurse has taken an exam, for an example, she goes back because she finds it's really comfortable and familiar, and because it's related to her work. It's so she goes and refers to other friends, and that's how we get a lot of referrals. So, and other colleagues recommendations. So these are the some specific reasons why candidate take OET. So can I get the next one, please? So maximum candidates are directly coming to us. That's more than 80% of the candidates now come straight to us, taking or considering OET as their first choice. 21% candidates are coming to us after attempting the other exams. So that's how we say that we are the best for, as if when it comes to the healthcare professionals, maximum candidates chooses OET as a first choice. Can I move to the next slide, please? Yeah, next slide, please. So now you are well aware about OET, so now it comes to the preparation part of it. So we do have, I would request everyone to go on OET.com and look for the resources there. We are we have a lot of our OET All-Stars, like they are the preparation providers. So we do, if you want to look for the area specifications where you can get one, or who should you be approaching to, I would request you to go on our website, look for the sample examples, look for our preparation provider list, master classes, register with us, because we do conduct live sessions, and there will be a lot of free resources, writing guides, listening, speaking. So, and we also have OET YouTube channel with all the candidates to go and explore our website, and you will find a lot of useful material, plus also linked to various social media where you can go and see our pre-recorded sessions also. Can I move to the next, please? So these are our all-star premium and preliminary providers. So you'll find the list on our website too. I strongly recommend to visit our website and get that information. There is a Q&A session where you have more and more information about your exam fees and other related information. And so I do suggest everyone to go and look into our website once. Can I go to the next one, please? So I end my presentation here. Thank you so much for listening and giving me your time. Any questions, I'm happy to answer right now. And in case if I don't have the answer, I will definitely come back. So can I take the question answers if anyone has it, please?
Thanks, Rinku. Joseph, are there any questions?
No questions have come now.
Okay, thank you, Joseph. So that concludes coming us to the end of our conference today. A little bit over our time, so thank you for sticking with us. I know it's late in the evening in some places. Once again, thank you. At the end of when the conference closes, there will be an opportunity to register to get your certificate of participation if you would like to receive one of those. And with also an opportunity there to give us some feedback on the conference, and what we did well and what we can improve on is always valuable for moving into future events like this. Just take a few minutes just to thank everyone who presented today. Really informative. We learned a lot from what everyone was able to say, and we look forward to you collaborating and participating with us in future events. So with that, shall everyone who's in the US, happy Thanksgiving for the rest of the day and the weekend, and for everyone else, enjoy your evening, enjoy your weekend, And thank you very much for your participation.